Hi, I'm Dr. Chris Edwards from Stucky Chiropractic, and today we're going to talk about Graston Technique. Graston Technique, and that's Graston, not Grafton. We're not grafting anything to the patient. We're actually breaking up scar tissue and we're breaking up soft tissue adhesions. We do this technique when maybe massage isn't getting deep enough for a patient and they're just having a hard time healing and they've had issues from repetitive use, surgery, or maybe a significant trauma that they've had and it's damaged the muscles, tendons, and ligaments in the area. Now this is an instrument-assisted technique, and the first thing we want to do when we're getting the area ready is we want to warm it up. Okay? And my patient Johnny here, he's been warming up for about 5 minutes now, which is just about the amount of time that we want to make the treatment more effective. So we're going to open the area up. He's going to rest his arm back down in the hot pack. He's had some problems on the outside of his elbow here into his forearm, so we're going to work right in that area a little bit. We're going to use a little bit of lotion so it slides and glides across the skin and we can get to that soft tissue area that are the problem without injuring the area anymore. The first tool I'm going to use is actually what we call a guasha tool, and it's more of a rectangular shape. But I'm using the Graston Technique, and I've been trained in both modules of Graston Technique. And we start with just some simple strokes. We kind of feel the area out and see if it's gritty or not. And if you're closer, you could actually hear, sounds like we're going across a washboard on parts of the skin. Do you agree or disagree?
I agree.
Okay. You can even see in a few spots where you get some petechiae. Now the soft tissue in here, and especially scar tissue, will have a blood supply. And when we break up that scar tissue, because it grows too, some of that blood supply might pop up to the top of the skin, looking what we call petechiae or a little bit of bruising. So we do a little work on the top side, and then we come back on the inside. And we try and hit it from all angles to break the fibers up. He's got a real good spot coming out here. And once I feel I've covered all the areas I want to cover and I've gotten all the angles I want, I have the patient just kind of wipe the lotion off, and I let him know that if it's sore tonight or anything, make sure that you get some ice on it, 20 minutes on, at least 40 minutes off, okay? And you can kind of see in his situation where he had some fixations in his arm, he's got a little petechiae or that little bit of bruising coming out right there, and from time to time that happens. But this is a great technique when other things have failed or haven't had much success as we'd like to see. And we've had about an 85% success rate on using Graston Technique to get areas moving more. If you have more questions, call the office and we'll answer any questions you have. Thanks.